I'm Dr. Justin Ezekowitz, the Director of Cardiovascular Research at the University of Alberta. I'm also a Professor of Medicine in the Faculty of Medicine and Dentistry. The Cardiovascular Research Institute is the newest of institutes supported by the Faculty of Medicine and Dentistry and is striving to improve the lives of patients with heart disease and stroke. So when we looked around the university campus, we were really excited to see that we have many great scientists, their labs, and people doing cardiovascular research. What we really wanted to do was foster a culture of collaboration and working together across many different frontiers that is both translational from the bench top to the clinical trials and back again, but also how people work together that allows people's discoveries to go across the traditional boundaries of cardiovascular medicine. We thought bringing people together will really amplify the successes and really help these labs and individuals and their scientific discoveries really reach a broader audience, but also attain greater degrees of support and funding. And then that would lead to an enhanced ability to translate those discoveries into the clinical practice and changing outcomes. Of all the different ways in which we've changed medicine in the last 10 to 20 years, cardiovascular care has really been at the forefront. We've had new discoveries that have changed heart attack care to make it more rapid and more successful, more therapies in end-stage heart disease, which have changed dramatically the outcomes of those individuals. Discoveries over the last 10 or 20 years have also led to new ways of treating congenital heart disease, women with heart disease during pregnancy or after pregnancy. And we've also had incredible changes in stroke care, which have revolutionized how well people do during their stroke and afterwards in their recovery phase. All of these changes were built off really fundamental knowledge of both the population that we're studying, but also doing the clinical trials that are needed to test new therapies, but then also having a good understanding of the basic science, the molecular science, or the genetics that may lead to those issues in terms of how people respond to therapies, or traditionally how they got risk factors for those diseases. So cardiovascular research has changed in a lot of ways in the last number of decades. It's gone from working in small groups and trying to make changes to working in large collaborative teams to make some quite dramatic changes to that way we care for patients. So that means we have to change how we think and how we work as a team science, and how we work together both within the city, within the province, across Canada and globally, to make sure we're always thinking, how can we change cardiovascular outcomes? The way the cardiovascular research is also being accelerated means that we've had new discoveries coming out each year, and these need to be translated into clinical practice very rapidly, and that's the science in itself. So we're looking forward to the way we transform the health of our local patients always, but also how do we change the global outcomes of all of our patients who have cardiovascular disease. February is Heart Month. That's very important for all of us, as heart disease and stroke affects all of us, whether or not it's a family or friend or a loved one. 9 out of 10 Canadians have at least one risk factor for heart disease and will develop some type of heart disease across their lifespan. The more we can do now in terms of discovery, in terms of research and science to enhance our understanding of that, the better now. So on behalf of the Cardiovascular Research Institute, thank you for your support.